All right, good afternoon, everybody. My name is Ashish K. I'm a professor of global health at the Harvard Chan School and the director of the Harvard Global Health Institute. And I want to welcome you all to Outbreak Week at Harvard, to HSPH, and the home of our second event of the week. So let me tell you a little bit about Outbreak Week. This is to commemorate the 100th anniversary of the 1918 flu pandemic. It is the most famous flu pandemic. It killed between 30 and 50 million people at a time where my friend Alan Brandt tells me there were only 1.5 billion people in the world. So it was an incredibly devastating flu pandemic that really lasted about 9 months, spread throughout the world, sometimes is known as the Spanish flu. And for those of you who wonder why it's the Spanish flu, it didn't start in Spain, and folks from Spain are a little resentful of that name. And that's because it was around the time of the end of the World War, and there was essentially media blackout in almost every country. So the flu was not being discussed because it was seen as a threat to the war effort. One of the few countries where people actually talked about the flu outbreak was Spain. So there you go, the downside of transparency, you get labeled the Spanish flu. So 30 to 50 million people died. Remains the most deadly pandemic that the world has ever seen, but remains that way, but it's not clear it will always remain that way for two reasons. The pandemic that we have been suffering through for the last 30 years, HIV/AIDS, has now killed more than 30 million people and continues to kill 1 million people a year. And so unless we develop a vaccine or develop far more effective ways of managing it, that is going to eventually take over as the deadliest pandemic, of course, over a much longer time period. So today's event, which I am very excited about, is entitled Global Disease Outbreaks, Shaping Public Health Infrastructure and Investments. And here is the key notion on this. Usually we think about public health infrastructure as a way to stave off bad disease outbreaks. But after these things happen, it changes how we think about public health. Now, of course, we wish we didn't have to have disease outbreaks to change how we think about public health, but that is what happens. And one of the things we wanted to do in this hour and a half is reflect on what the last century has taught us and how it has shaped us. And that is the motivation for today's event. We are doing this in conjunction with the Smithsonian Institution. They have a new exhibit called Outbreak, Diseases in a Connected World, and we were involved with the Smithsonian in creating that. And so you will see panels around here and in the back, and Shauna Jansen from the Global Health Institute will talk a bit more about that at the end. But let me start off now by introducing one of our key welcoming speakers, really the person to welcome you all here. Michelle Williams needs no introduction, the dean of our school, the Angelopoulos professor at our school and at the Kennedy School. Those of you who know Michelle know her as an extraordinary epidemiologist, an author of more than 450 publications, but really somebody who has just in 2 short years, it's all you've been dean, Michelle, I may feel longer, has really, I think, changed this school, has transformed it into an institution that is very much engaged in thinking about how to be more involved in the world, how to solve the key pressing problems that face human health. And so when we thought about this event, there was no better person to get us going than Michelle Williams. So Dean Williams, thank you for being here.
Thank you, Ashish, for that very kind introduction, and welcome everyone to this second activity of Outbreak Week. Ashish, I would just say thank you for your creativity and your energy and your leadership in pulling this all together, pulling us all together, and having us work towards looking back so that we can learn lessons from the past. Your leadership of Harvard Global Health Institute has really been a tremendous add to the Harvard landscape, and it is one of the touchstones for where One Harvard is actually being realized in the work that's being done that brings all of this massive talent across the Harvard landscape together to do things like this event and so many others that I could spend the hour and a half illuminating. So I want to thank your leadership, your team at Harvard Global Health Institute for envisioning, planning, and then executing on this incredible Outbreak Week and taking a leadership role in bringing us all together from so many different stakeholders across the fields, the academic fields, across Harvard and the world on this important topic. If you'll bear with me, what I'd like to do is walk you through a little bit of the history of the Spanish flu that Ashish started to talk about. So 100 years ago, on August 27, 1918, two soldiers arrived at Boston's Commonwealth Pier, just a few miles from here, really not far from here. And these soldiers appeared with flu-like symptoms. To the staff at the Navy Yard, the Navy sick bay on the pier, they looked like just regular cases. It had been a mild flu year that year, and they essentially looked like your typical normal set of symptoms for the flu. Just 2 short days later, there were 58 cases of flu in Boston. 2 short weeks later, there were thousands of cases. Who were the cases? They were young, otherwise healthy men and women who started to die, first by the dozens and then by the hundreds. A century ago today, to this day, on September 25th, 1918, Boston's Emergency Public Health Committee took action. It requested that all public gatherings be called off. Schools and places of amusements were closed, theaters were closed, and saloons were closed indefinitely. These places where people gathered closed indefinitely. It was only 4 weeks after the deadliest epidemic the world had ever seen to this day had made landfall in the United States. And it was 4 weeks too late for us to really recognize what was happening. When pandemics hit, the human toll and the disruption to society is massive. Let's consider this. Let's consider that more people died from the 1918 influenza pandemic in a year than the Black Death in a century. It cost lives in 24 weeks, more lives in 24 weeks than HIV/AIDS took in 24 years. In fact, this one novel, fast-moving, fast-spreading strain of the influenza virus took an estimated 50 million lives, more than any in history. From today's vantage point, it's easy. It really is easy to assess that back then no one was prepared. Newspapers described the efforts by the city officials as heroic but ineffective. As makeshift hospitals rose, misinformation spread, everyone was caught by surprise. Many nurses and doctors, the first responders really, were actually responding to another crisis. They were in Europe attending to wounded soldiers. Appropriate equipment was scarce here because so much of the resources had been pushed into the war theaters, and many caretakers died alongside their patients. This was a time when viruses and their characteristics were just beginning to be discovered in academic laboratories across the land. Few understood, for example, the role of travel in the spread of infectious diseases. The field of public health was in its infancy. Think about this. The Harvard-MIT School of Health Officers, which would later become our Harvard Chan School, was still in its early days and had trained but only 4 classes of physicians. 100 years later, tremendous advances have been made, no doubt, in science, in technology, and in health. We now have vaccines, diagnostics, therapeutics, public health surveillance systems, and public health governing institutions such as the Centers for Disease Control and the World Health Organization. We have experience with a broad range of epidemics, most notably recent outbreaks including SARS, Ebola, and Zika. Thanks to the global health security agenda created under the Obama administration, we have made significant progress in bringing nations together on this important topic. More than 70 countries have completed an assessment looking at their basic capacity to prevent, detect, and respond to outbreaks. But that's only 70 countries. So it is a striking fact that in spite of all of these many advances, we are globally still underprepared for the next pandemic. For example, more than a half of the world's countries have yet to report on their readiness to respond to a public health threat. Early warning signs of a failing health infrastructure are way too often ignored until an outbreak hits. And the importance of a robust disease surveillance network is too often underlooked, too delayed in that political will and the investment it takes to build that basic capacity. But maybe most importantly, 100 years later, we are still seeing a cycle of panic and neglect when it comes to preparing for infectious disease epidemics that have the potential to spread across the globe. A highly publicized outbreak such as the one caused by the Zika virus creates sudden attention. Then the attention dies off as soon as the outbreak seems contained. This is why we're gathered here today. This is why this Outbreak Week is so important. For anyone who works in infectious diseases, the question isn't if a next pandemic will happen, it's when. How do we sustain attention to build core public health capacities across the world so that we can be better prepared next time? What can we learn from past epidemics about building better systems? What are the similarities and differences across regions? How can we generate new ideas to sustain investments in these fundamental public health functions? These are important questions. And today, we will let history be our guide. I'm delighted to welcome distinguished guests from across many fields, including history of science, African and African American studies, demography, and from all across the Harvard University landscape. I look forward to what we will learn from this truly multidisciplinary look at disease outbreak, past and present. In our very connected world, infectious disease outbreaks affect everyone. Responding to them with resilience requires coordination and collaboration. 100 years after the pandemic of 1918, we have the knowledge and the tools to be prepared. It's in our hands to do better next time. Thank you for your attention.